move along, I'd like to introduce Rachel Baxter, who is new to our team for an education discharge for planners for safe and stable housing for youth and young adults. Miss Rachel.
Good afternoon. Again, my name is Rachel Baxter. I'm the Behavioral Health Transitional Age Youth Stable Housing Policy Lead here at HCA. First, I want to give some brief information regarding the work HCA has done to implement for planning for the Education and Discharge Planning Toolkit. In July of 2021, the Healthcare Authority Division of Behavioral Health and Recovery, in partnership with the Rakes and Schultz Foundation, supported an FTE position, which created the report titled Safe and Supportive Transition to Stable Housing for Youth Ages 16 to 25. It has best practices and recommendations for strong supportive communities. Within the report, you'll find data from Away Home Washington and the Office of Homeless Youth. The data shared by those agencies identified that 2 out of 3 young people ages 13 to 24 experience homelessness after they are discharged from a public system of care, and 1 in 5 transitional age youth are homeless within 12 months of exiting an inpatient behavioral health treatment facility. Within the research conducted, inpatient mental health or substance use disorder programs were not easily identifiable and found no specific program design framework. This includes discharge planning, which is important when serving the unique developmental needs of young adults. Inpatient treatment can be a rare opportunity to engage with young people and can complete a comprehensive and holistic assessment for successful discharge and community reintegration. During the legislative session in 2018, Washington State passed Substitute Senate Bill 6560, requiring Washington State Department of Children, Youth, and Families and the Office of Homeless Youth to co-design a plan to ensure no youth is discharged to homelessness by any public system of care. Later in 2022, to further this legislation, House Bill 1860 and 1905 were also passed. House Bill 1860 identifies that inpatient treatment facilities must engage in discharge planning with Medicaid managed care organizations, whereas House Bill 1905 identified the need for a rapid response team and flexible funding opportunities to support youth and young adults exiting any publicly funded system of care. In support of these initiatives, HCA is currently problem solving with DCYF to restore Medicaid coverage 30 days prior to release within correctional systems. This would ensure people can access critical care as they are released, and that housing insecurity is identified and discussed earlier. This also gives the opportunity for discharge planners to ensure a more comprehensive and realistic transitional plan to achieve once exited from these systems. The Department of Children, Youth, and Families Juvenile Rehabilitation has also hired a discharge liaison who will work with transitional age youth on reentry plans that will include housing discussions. Next, I want to give a quick overview of the notification system that is currently within the developmental phase at HCA. This system asks providers to notify managed care organizations that an individual is being discharged from a behavioral health facility with housing insecurity if applicable. This will give discharge planners the opportunity to work with managed care organizations to ensure care coordination and housing resources are offered. This effort will create a positive impact on individuals who may need additional assistance and support when exiting an inpatient treatment program. For House Bill 1905 specifically, DCYF is spearheading the rapid response team design and implementation. Additionally, a position has been created to ensure a liaison will work closely with other state agencies, providers, and the individuals being referred to the rapid response team for housing instability. The liaison will problem solve and ensure diversion conversations have been done at the lowest level prior to a rapid response team referral. The rapid response team will give individuals and discharge planners the opportunity to send in referrals and conduct case conferences to see how each agency can connect to housing opportunities that may not have been tried previously. Again, the rapid response team is still being developed at this time. DCYF convenes a monthly interagency meeting with HCA, OHY, DSHS, DDA, and others to discuss programs, educational, and problem-solving opportunities. Additionally, HCA has created internal work groups that include HCA staff from all sections as foundational supports to this initiative. Information regarding those work groups can be found on our website. The 4 work groups include data, payment, policy, and standards of training, which will reconvene in January of 2023. HCA also is currently in development of the Discharge Planners Toolkit. This will be an online survey that discharge planners may use prior to individuals exiting a facility to find housing options and programs that an individual may qualify for. HCA is also in the process of adding housing resources specific to transitional aged youth on the Pathways to Housing website. These online resources are also a way for providers to find out what housing resources are available within their local area. With these tools, providers will be better equipped to find safe and stable housing that will support an individual's recovery. So on this slide, you'll be able to see the links for housing for transitional youth. You'll also find the report regarding inpatient treatment and discharge to homelessness, as well as the Office of Homeless Youth report and dashboard. Thank you.